Hey guys, welcome back to Overhead Athletics. I wanted to show you guys a manipulation of dorsal caudal direction for C7 today. Unfortunately, Austin was supposed to be here about 20 minutes ago and I don't know where he's at. Okay guys, so Overhead Athletics here, we're gonna go through a little manipulation for C7 in a dorsal caudal direction. Austin was kind enough to be in a video before where we actually did a manipulation in the gapping direction or a cranial gap with a little bit of biasing into rotation. This manipulation incorporates rotation into the opposite direction of the side that you're gonna manipulate with side bending on the same side. A lot of times we see the C7 segment have issues with dorsal caudal movement or gapping movement. It generally becomes stiff as it's a transitional vertebrae between the thoracic and the cervical spine. This is a very safe manipulation because we're not taking the neck through large amplitude rotational movement, and we're simultaneously not going to put the neck in an unstable position where it can't tolerate load. I'm going to use the hypothenar eminence of my hand specifically down towards the base of the hand, and I'm going to contact just at the C7 vertebrae. C7 usually is the most prominent spinous process. I go just down and to the right of that for his left side, my right hand here. I bias him into a little rotation, and it's a little bit of rotational movement this way as a counterforce and a little bit of inferior kind of contralateral or medial force there down towards the anterior side. And that's it right there. Now to hit the other side, I can go into that same force. It's very fast. It's not slow. It's not a lot of movement here. The force comes with my opposite hand. Right there. That is the dorsal caudal manipulation for the C7 segment. I can likewise come more inferior and hit T1 in the same fashion. We definitely have some contraindications for manipulation anywhere. We definitely want to avoid big rotational movements that are going to load hypermobile segments and potentially load the V2 segment of the vertebral artery. Likewise, if somebody has a lot of arthritis in their neck, I'm not going to do anything that kind of biases them into a closed down position of the neck. If they have pain in the upper cervical, I'm going to kind of start to avoid this or be a little more careful and cautious with how I apply a manipulation. We've seen patients that have had upper cervical issues as a result of a similar manipulation performed improperly with too much traction and too high of an amplitude or too large of a movement. You want to be careful about those things. And if anybody has any sort of arteriosclerosis or other issues, vascular issues, we want to be very, very careful with this. We always want to make sure we assess the cervical spine before we apply any sort of manipulation. Because if you apply these manipulations improperly, you're going to risk some serious things. Especially, I mean, we've had guys get their teeth knocked out before with this very type of technique. We're kidding, of course, but the idea here is to be as safe as possible. Make sure it's specific, you've done your assessment, you know your patient.